Well, good morning, everyone. Hope you're having a great start to your day and always fun. Question and answer Friday. So we'll say hello to a few folks as they come on here. And we'll have our little roll call. Brahim, number one on the hit parade this morning. Andrea from Niagara Falls. Good to have you guys on. Our faithful. John, how are you? And Janice, nice to have you on with us. We appreciate it. Sandy from Fergus Falls, Minnesota. How are you? Yvette, how are you? And Rosa from Montreal, bonjour. Nativity, good morning. And Madeleine, Kippawa, Quebec, bonjour. Kevin, Oshawa. Nick from our staff. Nellie, good morning. And Jeanette, how are you? Ornella, how are you? Fran, Orangeville. Wendy from Markham. And Ornella saying she's having a coffee. And who was that in Newfoundland? Adeline. And Judy, New Brunswick. Colleen, good morning. Elaine, St. John's, Newfoundland. Donna from Bell Valley. Donna, another from Park Hill. Diane from LaSalle. And Ornella says she's great. Denise, Chatham, Kent. And, I can't see it. Sue, how are you? Manitoulin Island. Keith, Sunny Bell River. Sandy, I missed you. Didn't mean to. Arlene, good morning. Rosa, Linda from the Kidneys of Canada, Niagara Falls. Robin from Connecticut. Heather, Miramichi, how are you? And IT. Nancy, Gore's Landing. Jeanette saying hello to all her friends. Donna's, all over the place. Marlis, how are you? Sharon. And Jean, Jean, I would say. Linda from New Brunswick. Rose from Peterborough. And, I missed one. And I missed two. I can't. They go into clouds, guys. Alice. Jean. From Peterborough. Deb. How are you, Deb? And Karen from Moncton, New Brunswick. And we say hello to Moncton, New Brunswick. Donna. Newfoundland. Sandy, Chilliwack, British Columbia. Carol from Mount Pearl, Newfoundland. Lorraine, how are you? From Oshawa. Susan, she's in the clouds. Gloria. And Johanna. And Marcy. Okay, two more. I missed it. Carol, who is from Gilmore? Fran. Tilsonburg. Cecilia, how are you? And Dawn is saying hello to Arlene. I like that when you guys say hello to each other. Bonnie and Deb from Timmins. Okay, let's get going. We got lots of questions to get to. Some of them are coming back. This first one, they didn't hear the answer. Okay, we had some technical difficulties last week, question and answer. Jan, my husband was told to stop taking vitamins 7 days prior to his operation. And they told that they interfere with the anesthetic. Look, you have to understand when I say, Jan, I don't want to give specific medical advice. You can understand, okay? Your husband getting an operation. But I want to say this in a general principle, okay? They don't affect the anesthetic. It really doesn't. You know, it's amazing to me, most times, okay? Now, I understand if you're taking a colonoscopy, they might not want you to take anything the day before. I don't know about that. I'd have to just sort of look that up. But if you're getting an operation and they want you, for example, to stop a probiotic, like, I can't get over that. But you have to understand too, Jan, where they're coming from. They don't know anything about supplements. They really don't. And anything that they do know is probably negative. Okay? So, for example, they often equate omega-3 to a blood thinner. Not a blood thinner. Doesn't operate like that. Don't take this or don't take that. And, look, I'm not telling you what to do. I'm just telling you it's where they're coming from. When you don't have any background in supplements, you haven't studied them. And guys, by the way, this bugs me about pharmacists. A lot of pharmacists, they don't know anything about supplements. And the only thing they know is usually negative. So, guys, you know where I come from. You got to decide that. You got to make that decision. I don't want you to have a fight if you're having if you're going to have surgery. But I would tell people, look, you better build your immune system before that surgery. You ought to be on probiotics for sure. And, like that is really important to me. Vitamin D. You got to build your immune system so that you recover from that operation even quicker. But you didn't hear it from me. Okay? You didn't hear it from me, Jan. It bugs me. Okay? It bugs me. Marcy, I have a bump that looks like a blister on my tongue for over a month. It won't go away. Usually, okay, and look, if it doesn't go away, Marcy, you should have it checked out. Okay? You should have it checked out. But here's what I usually found when I saw that in my practice days. Viral. Okay? Like some people bite their tongue, literally, and they can form a blister there, or a blister-like. But if it's lasting that long, because the tongue usually heals very, very quickly. A lot of blood supply in the tongue. If it's not healing, I'd get it checked out. 1. 2, oftentimes it's viral. And it just takes time. I would be taking, do the vitamin D hammer. I like that hammer. Okay? I'm a big guy on that hammer. You feel the first sign of a cold? Hammer. Okay? Up to 50,000 IUs. I do it. 50,000 IUs for 2 or 3 days. And then I like, really important, anything in the mouth. Okay? And I don't know your particular situation, Marcy, but anything in the mouth oftentimes is low levels of B12 too. Okay? But I don't know your situation. Those are things that I would be watching for. Okay? Thanks for the question. We appreciate it. Krista, and this is one from last week too. My doctor called to tell me I have atypical lung pneumonia. That's walking pneumonia. Have I seen it? Yep. It's just a milder form of pneumonia. And what I suggest, Krista, again, hammer. The hammer. And by the way, part of the hammer is, not only using high levels of vitamin D for a couple of days. I've told you this story before, and it was actually published. A colleague of mine, 50,000 IUs, for 7 days for bacterial pneumonia. And these patients were actually on a ventilator. And the difference between the ones that were given that hammer of 50,000 IUs for 7 days in a hospital in Toronto, the difference was striking. Okay? I heard that Well, that was done over 15 years ago. Maybe not quite that long. Yeah, just about. Okay? Boy, time flies. Anyway, I like the hammer, and I like the hammer of oil of oregano with vitamin D. I just find oil of oregano is hard to beat. And hammer it. First sign of a cold. And by the way, Marcy, was it Marcy? Yes. Put oil of oregano on your tongue. If it's viral, put oil of oregano on your tongue. It's good for you. Internally and externally. Of course, you put it in your tongue, you're going to get it in your body. That's guaranteed. Anything in the mouth's going to go into the bloodstream. Okay. And Krista, yeah, do the hammer too. Like you're atypical, anything with lung. And by the way, one of my favorite supplements for lungs of any kind is quercetin. Okay? There's some new study out on quercetin and uric acid. I think somebody asked me about uric acid. Okay, we'll get to that when we get there. Okay, so Krista, thank you. Joss, or Joes, Joss. Anyone know what Dr. Martin's thoughts are on taking kelp? I like you take kelp for getting the iodine usually. Okay? So I'm not against kelp. Okay? You get iodine in kelp. I have iodine, by the way, in our thyroid formula with selenium. It's very important to have selenium in with iodine. Okay, because iodine on its own that's all right for your thyroid, but it's not good enough. Selenium is a key. Okay? And the best form of selenium is in eggs, meat, and cheese. The animal kingdom. Okay. Okay, and John is saying they're now adding citric acid to everything these days. Is it genetically modified black mold? I never heard that. John, I know what citric acid is, right? It's usually used in a powder form from citrus fruits. And it's, I've often seen it in cleaning agents. Clean. Some people say, put citric acid with baking soda. Makes a great cleaner. I don't know. I've heard that. But I don't know, John. That's the first time that I've ever heard that citric acid, and it's in everything. Yeah, I see it a lot. They can put it in food. I've seen citric acid used in food as a stabilizer type of thing. Is it genetically modified black mold? Well, you know what? I don't know, John. If you could send me where you read that. I haven't ever heard that before. Maybe you're teaching me something. I'll have to go look it up. Okay? I'm going to say no, but I'm saying no with a big question mark, because I never heard that before. Okay? Okay, Cynthia. What can you do to help with POTS? Capital P, capital O, T-S. And that's a form of tachycardia that, here's what it is. When you stand up, okay, you often go down. You can faint. And it's rapid. You stand up fast, and it's a condition that's, I'm not going to say hard to diagnose. It's just that most doctors are not really looking for it. I mean, to test it, you have to sort of lie down, take their blood pressure, take their pulse rate, and then watch what happens after they stand up. And a lot of times that goes down and they go down. I've seen it. Like, there's a few things you got to look for. Make sure you're not, people like that generally I found were dehydrated. They didn't even realize it. They often had insulin resistance and the connection to that. A lot of people have it. A lot more people have it than, but it's not always that easy to diagnose, because you literally have to do that testing where you lie down on the floor and get up, and then they test you again, test your pulse rate and your blood pressure. Okay. Kim, this doctor I listen to says that AGES, which is advanced glycated end products, and how we cook our food creates this in us. It is quite profound. He really believes that we should not grill, fry, bake, or use dry heat or brown our food. Well, Kim, I don't know who this doctor is. Is it a doctor? Yep, it's a doctor. I disagree. That's not how you get glycated end products. And let me prove it to you. Okay? Let me prove it to you. One thing we know for sure, which creates glycated end products, is A1C. It's a blood test to check for glycated hemoglobin. Okay? And what glycates hemoglobin in your red blood cells? They can measure it. What glycates that? Sugar. Sugar glycates, not cooking, not baking. It might glycate, cooking and baking or grilling meat, for example, might glycate the meat, but that's not glycating you. Do you know what I mean? I think he's got it all wrong. And again, it's the proof I have for you is what sugar does to a red blood cell. It glycates it. I tell you guys all the time, all the time, what is in a no parking zone in your blood stream? Sugar. It's in a no parking zone. Your sugar is so tightly regulated in your blood, and there's a reason for it, because it's toxic. It's toxic to blood vessels. And I'll go a little further. Sugar destroys blood vessels. Ask a diabetic. Ask a diabetic. Kidneys, glycated end products, blood vessels getting destroyed, kidneys. Eyes, blood vessels getting destroyed, glaucoma, diabetic retinopathy, blood vessels getting destroyed, okay? Cataracts, blood glycation, and even heart disease, guys. Okay, think about this for a minute. Okay, you can actually measure A1C. Sugar glycates, okay, ages the red blood cell. You can measure it. But it also, think about it, it destroys collagen, skin, muscle. If you're just a sugarholic, it will destroy collagen. And think of collagens even in your blood vessels. It helps with the elasticity of your blood vessels. It helps with that little lining you have inside your blood vessels, endothelial. You lose the Teflon layer of your blood vessels. That is the start of atherosclerosis. Guys, it's not cooking your food that does that. What they really don't want you to do is eat meat. Okay? We don't want you to barbecue your steak. You know how many? I've heard that, guys, for 50 years. Don't barbecue your steak because it's bad for you. No, it's not. I push back on that. But it's always the vilification of meat. Always. The vilification of meat. So you get doctors and they'll make it up if they have to get you to become a vegetarian or a vegan. It's a religion, my friend. It's a religion. And good luck trying to change their minds. But I'm telling you, that is silliness. Because we know already what happens inside the bloodstream with sugar in your blood. Now you're going to have a teeny weeny bit of sugar in your blood. That's normal. But you know what insulin does? Insulin is a traffic cop. Sugar, can't park there. You can't stay in the blood. I know what you're going to be up to. You're going to destroy blood vessels. Starts with capillaries. Come here. Can't park there. Now I'm going to park you. That's what insulin does. It's the traffic cop. It's the traffic cop to store glucose, sugar. Come here with me. Out, out, out. Okay. I got going because I hear that, I heard that on advanced glycation end products 30 years ago. Don't cook your meat. What they meant to say is don't eat meat. What are you going to do? Eat sushi the rest of your life? Anywho, okay, I get excited, Kim, I do, but because I have to push back. I push back. It's not true. Okay. And you say it is quite profound. Well, it is very profound if you believe it. I don't. Okay, Barbara. Is it true there's no real cure for COPD? Well, I can tell you there has in 50 years of practice, just about. I've seen COPD reverse maybe once or twice, but generally, what you want to do with COPD is get it better. Not reverse it. If you can reverse it, that's a miracle. Okay, because it's very hard to reverse it. But I do everything. I used to deal in my practice with deficiencies. I didn't guess, I test. Okay? I didn't guess, I test. Did I just make that up? I like that. I didn't guess, I test. And here's what I found. COPD, okay. Very low in vitamin D. Generally. They did not have optimized B12 levels, generally. They were low in magnesium, generally. They had leaky gut almost invariably. Okay? Leaky gut, leaky lungs. Okay? And so what I did in my practice, you know me and my food, I always start with food. I always started to get them off anti-inflammatory foods, which is carbs and sugars, by the way. It's not meat. So eggs, meat, and cheese, Do the reset for 30 days. And fix leaky gut. Don't feed the bears. No sugar given to yeast that loves to get into the lungs. Fungus. Clear that up. Probiotics. Okay? Eat steak. It feeds your good bacteria. And I like quercetin. I told you that. Magnesium if they need it. And I give them B12. B12 is good for everything, okay? And usually they were very low in vitamin D. We took care of that, okay? We took care of that. So I didn't guess. I test. I like that. And remember, in my book, Sun, Steak, and Steel, you see it behind me? I tell you what 8 blood tests you really need to, those biomarkers that you need to get checked. And I tell you what the numbers are, and I tell you what to look for. And when you get your blood test, just take my book out and read. It will tell you from A1C to uric acid to triglycerides and HDL. I tell you in the book. Okay? All right. Thank you for the question. I much appreciate it. Barbara, Monica, does ultraviolet light therapy at home help with psoriasis, eczema? I can. Yeah, I like it. I like ultraviolet. I love the sun even better. But an ultraviolet lamp, okay? I remember my dad using an ultraviolet lamp in his practice in the, when I was a young boy in the 60s. Okay? He was very big on it. Okay? For skin conditions. Yes, I love it. Plus, you got to work inside too. Work inside out, because I've never seen eczema, psoriasis, or whatever without leaky gut. Never, 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 never. I've never seen a case of it. They always, always have leaky gut. They have an overgrowth of the Trojan horse fungal. Okay? You know, because people think, well, toe fungus. That's what they think. Well, I don't have fungus. I got toe fungus. But if you got toe fungus, you got fungus everywhere too. Okay? Okay? That's something you can see, but on the inside, you don't necessarily see it, but it comes out. Psoriasis, eczema, dermatitis, fungal. Okay. And Gail is going for a knee replacement. I don't tolerate pain medications, okay? I take 4-DHA. You're a smart girl. And what else can I do? I would add curcumin. And I wish our inflammation formula was more available. We're waiting good news, I pray, for that product, because it's so good. Oh, anyway, I don't want a migraine this morning, so I won't talk about it. But I would add curcumin. Navitol is very good too, very anti-inflammatory. Okay, Gail. And you know what? When you're going in for surgery, you make sure you're taking your probiotics before and after, big time. Double them up. Double them up. Barb, what does Dr. Martin think about hydrochlorothiazide? Oh, you're meaning diuretics. Okay, so they give you a diuretic. It's one form of a diuretic is usually to get rid of edema. They often use it for high blood pressure and got lots of side effects. That's the only thing, it can really lower your potassium, really lower your electrolytes. And if you got kidney problems, it can be a big, big thing. So look, again, I can't tell you as an individual whether you take a medication or not. Just be extremely aware of the side effects of a diuretic. Google it. Look at side effects of diuretics. And they're legion. Very careful with those things, okay? Susan, does bone broth raise blood sugar? No. No, it shouldn't raise your blood sugar. At all. If anything, it would help your blood sugar. Help to regulate, not raise it. Regulate your blood sugar. Love bone broth. Bone broth is collagen. Collagen protein. And bone broth is a better collagen protein than just collagen protein because it's got a lot more vitamins. It's got a lot more L-glutamine. It's got a lot more of nutrients than you can buy collagen protein. I don't mind it, but the best collagen protein is a bone broth protein. And it doesn't raise your blood sugar, no, Susan. Sue, what are your thoughts on ice baths? Well, look, okay? This is me, okay? Generally. Ice, maybe at the start of an injury, okay? At the start of an injury. Then I was a heat guy. Bring more blood supply to the area. Now, ice baths, I know why they do them, okay? For your metabolism and that. I've read a lot about that kind of stuff, and you know what? I don't know. I'm a little bit indifferent about it. I mean, some people really like that. You don't get me in no ice bath. Except that if you put me in a sauna first. Like I remember as kids going into a sauna and then jumping in a lake that, well, one time I'm telling you in high school, we cut a hole in the lake and the sauna. And you know, is it therapeutic? I don't know. You wouldn't get me in an ice bath today if your life depended on it. But I'm not saying it's got no benefits. I'm just saying you ain't getting me in there. Okay? I like a nice hot bath. How's that? With some Epsom salts, magnesium salts. Okay? No, good. Look, I've read the stuff. I've read about it, how good it is for your heart and good for your metabolism and good for your muscles and good for this and good for that. I don't know. Immune system. I'm not sure. I don't know if I buy it. Okay? I'm not saying it isn't. I'm just telling you, I don't know. Okay? Good question. Thank you. And sometimes I'm not going to give you the, total answer because I don't know. I haven't been convinced yet. Okay? Willie, is it normal to urinate often at 56? Not normal, but I do not feel like I've emptied my bladder. Well, it's really not your bladder, Willie, usually, okay? If you're a man. Women, it can be your bladder. Now, Willie, I've known some women that are called Willie. So it's important for me to know which you are, a man Willie or a woman Willie. Because what happens in men, it's not their bladder, it's their prostate. And at 56, yeah, you probably have benign hyperplasia, okay, which is a prostate inflammation. It's a prostate swelling, and that can affect your urination. You'll go frequently. You might feel like you're not emptying, or you might be drip, drip, drip. Now, if you're a woman, yep, you're menopausal or perimenopausal or, okay, and the bladder sometimes starts descending a little wee bit. And you might not feel, remember the bladder is a smooth muscle. It really relies on progesterone, okay? And a lot of people think it's estrogen, but I'm a big guy on, we got way too much estrogen in the universe. We don't need any more of it. I'm a big guy on elevating your progesterone. So I dim out estrogen, dim, D-I-M. If you notice our menopausal formula has D-I-M, dim, and I elevate. I have ingredients in there that elevate progesterone. Progesterone goes up, it will balance your estrogen, okay? And again, Willie, I need to know, man or a woman? Anatomy is different there. I don't even know if I can say that anymore. I don't care. I'm still saying it. We're different. Okay. Thanks, Willie. Gertie. How many more questions? I think we can get them done today. Gertie, a 50-year-old female has androgenic alopecia, autoimmune, and perimenopausal. How much hormonal support is safe to take? I'd be giving them around 4 a day. She does flax seeds, beautiful, because that's as well as saw palmetto DHT. Yeah, I don't know. I would never, look, I don't mind saw palmetto, but I like the hormonal formula and the flax seeds for sure. And look, with androgenic alopecia, she has autoimmune, Gertie, 100%. So knit up that leaky gut. I used to see that a lot in my practice. And I'm telling you, I started with the gut and the diet. Don't feed the bears. And it really, really helped them big time. Okay? Really helped them. Hormones, you bet your boots. Way too much estrogen. Way too much. Okay. Brenda, what helps endometriosis? Get the estrogen down. Endometriosis is you're too much of a woman. That's what endometriosis is. Way too much estrogen versus progesterone. And that makes that endometrium grow. Okay? Endometriosis. Thought it 1,000 times or more in my hormonal days in practice. Okay? Hormones. Too much of a woman. Fix that. Dim it out. Okay? Really important. Dim that Brenda, dim out that estrogen. Doreen, can you eat meat if you have glomerulonephritis? Yep. Yes. See, look, I get it. Training in medical school is this, okay? Kidney disease, meat. Kidney disease, protein. Too much protein. No. They got the premise wrong. The premise is wrong. The foundation is wrong. It's not protein. Because they see protein in the urine. I know that. But you get protein in the urine when you're consuming too many carbohydrates and sugars. There's nothing harder on the kidneys than sugar. They got it wrong. It's not protein. Now, if your kidneys ain't working at all, well, you know, maybe if you had 20 pounds of protein, it wouldn't be good for them. But it's because the kidney ain't working at all. But even then, look, the reason we got so much dialysis today is not because of people eating more meat than ever. It's actually we're eating less meat than ever, and we got more kidney disease than ever. And I'm telling you, it ain't meat, it's sugar. But their premise is wrong, because I got taught that, by the way, in school too. What did Mark Twain say? Education is about unlearning everything that you learned. I learned it in school. Kidneys, protein, bad. Protein, bad for kidneys. Nah, sugar's bad for kidneys. The best food you can eat for your kidneys is steak. Okay? Okay. I know that goes against the grain. I know that. Okay? Okay, a couple of more. Cecilia, been on the reset since October 1st, and my husband has diarrhea. What can we do? Well, look, that's going to be temporary. Okay? He's probably had a major fungal in his body. And his body is saying, hey, out, 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 because you're detoxing. The best detox, by the way, is when you empty your liver. So you get diarrhea. I don't worry about diarrhea so much. Now, if it lasts forever, yeah. Okay? And, but your body's detoxing. It's getting rid of stuff. And sometimes that includes some diarrhea. Now, just make sure he's not getting dehydrated, okay, with diarrhea, because that can happen fast, by the way, with diarrhea. Get dehydrated. So just make sure that his water levels are good, plus electrolytes. Okay, make sure. Okay? Thanks, Cecilia. Colette. Okay, just two more. Okay. Colette, what are your thoughts on lowering too much uric acid in the body, please? Well, look, it's a good question, Colette, because look, uric acid is normal. Everybody has uric acid. And if it's too low, have I seen uric acid too low? A little bit, but today, in this day and age, it's usually the opposite. We put a newsletter out this week on uric acid, okay? And uric acid without gout. And why? It's the amount of fructose. High fructose corn syrup it's up 3,000%. And gout is up about 300% compared to the 1980s. Is there a coincidence? I don't think it's coincidence. We changed the sugar. And now we got way too much uric acid. If you don't have enough uric acid, that could mean that your kidneys are not working properly. Too much and too little. Okay? Colette, thank you for the question. Marie, I have large varicose veins, having laser done on them. Okay. Do you have an opinion on laser treatments? If they work, use it. Okay? If they work, go for it. Both legs are itchy lately. Well, that can be due to the laser. I think that would be a common thing. Usually with itchiness too, it's very, very common when there's itchiness often goes with vascular insufficiency. Okay? When you got those big varicose veins, and if there's any insufficiency, itchiness can be a sign of that. Your skin is itchy, especially on your legs. Now, I don't know if it's just your legs or, let me just see, Colette, if you answered that again. Okay. And both legs are itchy. Yeah, that's vascular. Okay, that's vascular. Any suggestions on the itch? Yeah, rub some oil of oregano on it. Yeah, I'm telling you. And take Navitol too. It's good for the inside blood vessels, okay? Because it elevates your nitric oxide. Okay, guys, thank you very much for all those questions. I know some of them are, we did again because of last week's technical difficulties. You guys are wonderful. Thanks for all the questions. We appreciate it. I know I'm opinionated, but that's me, guys. That's me. Okay. Love you dearly. Talk to you soon.